But right now we are joined by Chanté, Franco, and Lindsey Gray. So Chanté Franco, she's a warrior and Army veteran, and Lindsey Gray, she is the suicide prevention manager for Wounded Warrior Project. Now, September is Suicide Prevention Month, and these ladies are here to talk about what veterans face, especially when they do come home. According to the U.S. Department of Veterans Affairs, 17 veterans die by suicide every day. Ladies, such a staggering number right there. Let's talk about this a little bit. What are the early warning signs when it comes to suicide, and especially in veterans when they do come home?
Yeah, I think the challenge among the military and veteran community is they get really good at putting a mask on. So it makes these warning signs sometimes harder to detect. But if you're someone who's concerned, right, we're really just encouraging you to pay attention to changes in things like mood or behavior, in things like sleep habits, appetite. Any of those small changes can really be a signal that they might be struggling with thoughts of suicide.
And Chanté, thank you so much for your service. We really appreciate it. What was one of the hardest things about coming home and just kind of trying to live every day-to-day life?
It was hard because I was one of the many who their identity was the uniform. And so when I wasn't wearing the uniform, I didn't know who I was. And then a lot of what I had went through while active duty, I never processed until afterwards because now I had time to think.
Yeah, I'm sure that can be so difficult. Let's talk about the Wounded Warrior Project and how it's helping veterans. What is behind this, and how can it actually help people who are coming home?
Yeah, so we're trying to take a pretty holistic approach to ultimately the goal of ending veteran suicide, and we're doing that in a few ways. So, one is through building awareness, decreasing stigma about an otherwise taboo topic, right? Opening conversations in our communities that encourage people who might need to seek help to do so. Next is through action. We know that there are life-saving programs and services available that are important for people, whether that is a veteran, their family, a service member, to be able to access to. And for us, that's at no cost. That's also connection to peers and community again, because to Shantae's point, so many people lose that sense of community when they leave the military. And lastly is through advocacy efforts. So on a national scale, how can we amplify the voices of our alumni to advocate for things like increased access to care, reducing barriers to those care so that the people who need those services are ultimately able to get to them?
And Chanté, what would your advice be to veterans who are, coming home or are back for the first time? What would you say to them?
I would say immediately put yourself into a community, build connections, lean into the connections that you already have, because it is very easy to feel alone.
Absolutely. I know, obviously, suicide is a very sensitive topic. How can family or friends go about talking to their loved ones and veterans about getting help, or maybe asking just how they are and if they have any of these thoughts?
Yeah, I think, to your point, it's sometimes just starting with as simple of a question of how are you really? Approaching or leading with curiosity. It's easy, especially if this is a friend or a family, to sort of assume that we know what they're going through or how they're feeling. And so really staying out of assumptions, avoiding judgment. And if your gut is telling you that someone might be struggling, asking really directly, are you thinking about suicide? Because if we're not being direct, it makes what is already a really challenging conversation for people even more difficult. And we want people to be able to answer honestly if they are struggling.
And where can families and veterans go to learn more about this program or how they can get help?
Yeah, so you can visit woundedwarriorproject.org/prevent suicide.
Great. Thank you guys so much. Chanté, once again, thank you so much for your service. We really appreciate you guys.